Hello listeners, a warm welcome once again to Views on Health, and as yet another Monday evening comes by, it's a pleasure once again to have with me on the program tonight Professor Priyanga Ranasinghe, Professor in Pharmacology, the Department of Pharmacology, Faculty of Medicine, University of Colombo. On the program tonight, Professor Priyanga Ranasinghe, in his capacity as a professor in pharmacology, is going to speak on pharmacogenomics. That's quite a mouthful there, Professor. Without any further ado, over to you to explain this very technical topic to our listeners.
Thank you very much, Fatima, and thank you for inviting me to be on the program. Yes, it is a very technical term. The term simply means, the term pharmacogenomics is a combination of two words, combination of pharmacology and genomics. So it provides a link between the medicines and the genetic factors of an individual. Basically, the idea being to study how the genetic profile of a person affects how you respond to medicines. I will just tell you the history briefly so that you can understand the term better with that. So we know that we take medicines expecting a beneficial effect or an outcome. And people have realized over the years that not all of us respond in the same manner to an individual medicine. Although the medicine may be working by binding to the same receptor in all of us, not all of us respond the same way. You don't see the same effect at the end of the day. And to some medicines, some people don't respond at all. So people were thinking there could be many reasons behind this, but one of the factors that have been attributed to this is the genetic variations between individuals, which not only determines how we respond to medicines but also some of the adverse effects that we experience due to medicines could be related to the genetic variation between individuals. So essentially, pharmacogenomics is the study of how different individuals respond to and the different adverse effect profiles experienced by people when using medicine in relation to their genetic variations.
Interesting, Professor. Thank you so much for that introduction to the topic, pharmacogenomics. And can I ask you, how do genes and medicines work?
Yes, so we all know that the human genes are responsible for the production of the various proteins that we require for the normal functioning of the body. And these proteins are things like receptors, which different molecules bind to bring on their effect. These proteins are things like enzymes, which are important for different actions in the body. So when you take a medicine, essentially what the medicine would do to bring on the effect is similar to the endogenous or the molecules that we have in the body. The medicines will also go and bind to the receptors. The medicines will also bind to the enzymes and modify its activity. So now the genetic profile between individuals are variable. We all know that everyone has an individual genetic fingerprint, as we call it. So the expression of the proteins, the enzymes and the other factors will not be the same among all individuals. You may be having 100% of expression, whereas I may be having 50% of the expression. So in that sense, you may be having 100% receptors, whereas I may be having 50%. That is just one example. That is when we talk about the effect. Now, when we take a medicine, the medicine is also subject to change, what we call metabolism, in the body. The medicine is metabolized or changed, especially in the liver, and then it is eliminated from the body. Now, these changes are done or catalyzed by what we call enzymes. And as I said earlier, these enzymes, the expression of these enzymes will be variable between individuals because of genetic variations. So that plays a major role, especially in deciding the dose of a medicine. So let's take an example. Let's say medicine A is changed in the body, in the liver, by an enzyme where the expression is variable between people, and one person may have 100 copies of that enzyme and another person may have 50 copies of that enzyme. So if you give the same dose to those two individuals, obviously you will realize the person having the 100 copies will metabolize or change the drug faster. The person having 50 will metabolize or change the drug slowly. So then the rate of change or removal from the body will be variable between these two individuals. So ideally speaking, these two individuals should not get the same dose of the medicine. The person having the lower enzymes will require a lesser dose. So people have realized over the years that these changes do have a clinical importance, as we call it, in not only determining how you respond, but also in looking at adverse effects experienced by you.
It's getting more and more interesting. It's very technical, of course, but I'm sure our listeners will be, educated along the way on how this whole thing works. Now, when you talk again about pharmacogenomics, how does it affect drugs, the designing and its development?
Yes. So, Fatima, with the realization that people respond to these medicines differently, now we know in the drug development process there are two things that happen. Number one, you have a process which is entirely done in the laboratory using computers and all of that to model or develop molecules that bind to targets. So people, when developing drugs, have looked, now we have a better understanding of the presence of these variants, and people have taken the presence of the variants into account when developing medicines, even using computer modeling. The second thing, once the drug is developed, it is tested in humans, and these are done in what are called clinical trials. And the most of the new studies happening, especially in relation to diseases like cancer, are looking at genetic variants in those study populations and correlating the effects that they see with the genetic variants, so that once the medicine is licensed, eventually they can give recommendations based on the presence or absence of these genetic variants in individuals. So the pharmacogenomics and the genetic variants, the understanding of which is being increasingly utilized in the drug development process for us to have a better understanding of how to use these medicines once they are licensed.
Now, just taking our situation in Sri Lanka, in what respect would you say such information, the knowledge that you're sharing with our listeners, would actually be shared with the medical fraternity? You're lecturing at the university, so you're lecturing the students, but those who are already qualified, the doctors are practicing, it will be vital for them to have this information and be sort of know how this whole aspect can be handled. Could you comment on that, Prof? It's interesting for our listeners to know.
Yes, Fatima. Now, with the realization of these individual responses, there has been a lot of research done in this area. Initially, most of the research was focused on diseases like cancer, the cancer medicines, and at the moment there are about 200 medicines, not only cancer, where there are what we call pharmacogenomic recommendations. When I say a pharmacogenomic recommendation, the US FDA, for example, they say for a particular drug, the presence of this particular variant in the individual is going to affect the dosing, is going to affect the adverse effects, is going to affect the response. So what we call these boxed warnings appear in the US FDA website. There is a website for healthcare professionals called PharmGKB, which is a consortium of people, researchers and others getting together, which publicizes all these medicines and the genetic variants, and also tells you information about the presence or absence of these variants in different populations. Now, the one thing we have realized over the years is that the genetic profile, although individually variant, tend to cluster together depending on your race. So we know for sure now that those of European descent are genetically distinct compared to those of South Asian descent. Those of South Asian descent, irrespective of whether it's Sri Lanka, India or Pakistan, they are relatively what we call homogeneous. These websites which I talked to you about tells you about the medicine and the presence of these variants in these different populations. And then going further, gives the recommendations of what you need to do in relation to adjusting the medicines to suit individual needs. But as I said earlier, it's a relatively new field in its infancy, and a lot of information is just emerging at the moment and moving beyond cancer and coming into common diseases like hypertension, hyperlipidemia, use of what we call antiplatelet drugs in heart attacks or ischemic heart disease. These are just coming up.
So it will play a very vital role in how medicine is prescribed.
Exactly. Now I will take a common example and based on some research we have done here in Sri Lanka. One of the common medicines that we take for high cholesterol, as we say it, is a medicine called statin. The guidelines recommend a certain dose, but what we have to realize is that these guidelines are based on studies done in Europe or in the USA, where the populations are genetically distinct. Over the years, people have studied genetic variants that are responsible for the modification of the effect of statins and also how it is handled or metabolized in the liver. And we have studied the presence of these variants in the Sri Lankan population, and some of the variants present in our population makes it possible for us to use a lower dose in our population rather than what would be recommended in guidelines coming out of Europe or the US. If we were to use that same higher dose, our population might experience more adverse effects because you are going beyond the requirement. So statin is an example of a common medicine which a lot of people use, where the dose requirement may be lower in our population.
Thank you, Professor. So it's very relevant to our population. And how does one deal with this? I mean, it's relevant, all right, but then how does a doctor handle this situation?
Yes. So one of the key things is to be aware about the presence of this, and then if your patient is not responding, if your patient is experiencing adverse effects for these medicines, maybe it will be a good idea to look at the literature. As I said, evidence is just emerging, but there is a whole lot of information published. If you look at a reliable source, they will tell you. I can mention few medicine names for the purpose of healthcare professional, things like statins, antiplatelet drug known as clopidogrel, which is used in patients with heart disease, and then even painkiller medicines like codeine, a blood thinner like warfarin. These are medicines commonly used. So if you do realize that your patient is not responding to these medicines, or if you feel that they are experiencing adverse effects due to these medicines, it may be a good idea to consider the presence of these genetic variants and look at the literature and consider adjusting the dose to suit the patient. For example, another classic example, as I mentioned earlier, is warfarin. Warfarin is given as a blood thinner in certain indications. And again, based on some of the research we have done in Sri Lanka, there are certain variants present in our population where we might need actually a higher dose of warfarin to get the desired effect than in other populations. So then if the patient is not responding, and if you are sure the patient is taking the medicine correctly, then you could consider the presence of genetic variants present in that patient affecting the response to the medicine. But unfortunately, one of the limitations in all these pharmacogenomic related things are the absence of test. Not the absence, but the expensiveness of the test. So at the moment, unless very few medicines, there are recommendations for you to do genetic testing prior to starting medicines, especially in the field of cancer. But otherwise, this is not something that is uniformly tested for the presence or absence at the moment. But in the future, we might see.
Just digressing for a moment, and since you spoke of cancer, there was some information that was floating around quite recently that some sort of cure has been found in terms of drugs for certain types of cancer. Is that something that we can hope for in the future, something to look forward to?
Well, cancer-related medicines are things that are evolving, and there's a lot of effort and research spent on this. And there are certainly efficacious medicines for certain types of cancer. And what we have to remember is cancer is a whole set of diseases. It is not a single entity. There are certain types of cancers for which even now there are very effective treatments that are available, and people do spend a lifetime free of the cancer at the end of the day. But unfortunately, for most cancers, what we have are therapies that at the moment do help in prolonging life, but does not cause a complete cure. But an important public message, especially I think in Sri Lanka, there are a lot of medicines that are being advertised or marketed as being effective for cancer. But I would advise people is to do your own search about these medicines. Look at the ingredients, look at where it is coming from. And if you are keen enough, these products will have information to contact the people who are marketing them. Contact them and ask for evidence of what they mean by a cure. So that is very important, because at the end of the day, in terms of Western medicine, when we talk about evidence, we talk about something being tested in clinical trials, something being tested and approved by the NMRA in Sri Lanka. So just check whether all these things are satisfied, because at the end of the day, you don't want to take a medicine that will not cure you. They might cause adverse effect and worsen the condition. So you will also have to keep that in mind.
Important message. Thank you, Professor. As far as research is concerned in this particular field, how effective is that?
There's a lot of effort spent on this, because especially in countries like UK and the USA, there is a talk about what we call personalized medicines. So that is the future that is being targeted, where when an individual comes, you check their genetic profile, and depending on that you select the treatment so that they are on the best treatment that is appropriate for their genetic profile. They respond extremely well and they experience minimal adverse effects. So there is a lot of effort being spent on that, but unfortunately, as I said earlier, genes are highly variable. There are lots of variants that are there. If you go to these published resources, you will realize. And unfortunately, the tests are quite expensive at the moment, and they are not readily available. But maybe 10-20 years down the line, personalized medicines is something that we would see.
If you speak of genetic profile that you spoke of, how can that work in Sri Lanka to get one's profile along with one's genes?
I mean, even in Sri Lanka, there are facilities available in laboratories where you can test genes. The faculty that I represent also has a genetics unit where all the state-of-the-art facilities are available to analyze genes, and some of the research work that I talked about earlier on medicines are based on analyses done at the genetics unit. So certainly facilities are available, just that they are not readily available. It's not like getting your blood sugar tested, and they are a little expensive at the moment.
But it is possible.
It is possible, yes.
If somebody wants to, they can get it done.
In the sense, it would be done based on a recommendation of a healthcare professional.
There's a need for it.
When there's a need for it, yes.
I understand. That is important.
Yes.
It's not that everybody can just go and get it, no.
Exactly. It doesn't serve any purpose for you to get your genetic profile tested at all. It is done with a specific purpose in mind, with a recommendation.
And it's a medical process.
Yes. Yes.
Thank you, Professor. That's very important, because I wanted to clear that so that our listeners are aware that it's not something that you say, like you said, over the counter, or, you can just get it done as a regular test. But no, it is a specified and a special process that is done if it is necessary.
Exactly, you're right.
Professor, time is almost up. What would be your take-home message?
I would say that pharmacogenomics is a up and coming field, and I think especially the healthcare professionals need to be aware about the presence of it, and that our population, being South Asians, are quite distinct from other Europeans, and when we are looking at guidelines or recommendations coming from those countries, we also need to consider the presence of genomics and those variants, and that the requirements may be different in our population.
Thank you so much, Professor, because this is a very interesting topic, pharmacogenomics, and I think I, for one, learned a lot listening to you. Thank you so much as a layperson, and we sincerely hope that your efforts in this particular field in Sri Lanka will certainly bear fruit.
Thank you very much, Fatima.
Our grateful thanks go to Professor Priyanga Ranasinghe, Professor of Pharmacology, Department of Pharmacology, Faculty of Medicine, University of Colombo, for being with us once again in the series of programs, Views on Health, and we truly appreciate your input on this program, Professor. Thank you so much once again.
Thank you.
Thank you too to Damayanti Kulumbage for technical assistance. I'm Fatima Razi Kada saying good night and looking forward to company next Monday, same time on Views on Health.